Suspended animation, apparent death or death trance. Suspended animation, it is a state in which a vital function, heartbeat, breathing of a patient are reduced to minimum and cannot be detected by a routine clinical method, and the person appears to be dead. The person is actually alive, but he appears apparently death as pulse is not palpable. Heart sounds are not audible. Breathing movements are not visible. Reflexes are either absent or not possible to elicit. A person may live in the state of suspended animation for a few seconds to more than 30-minute mechanism. The metabolic rate is greatly reduced, so the body requires very less amount of oxygen, and only the dissolved oxygen in the body fluid is sufficient to maintain the vital function at a very low pitch. Types and causes: voluntary death causes and involuntary death causes. Voluntary death trance. Some yoga practitioner and sadhus are said to have the capacity to pass into a trance or death-like state by doing paranayama, meditation. The involuntary delping, drowning, electric shock, lightning, strike, poisoning, opiate, barbiturate, anesthetics, infections, cholera, typhoid, newborn, hypothermia, heat stroke, hysteria, hypnotism, head injury, concussion, other ICU, that is insanity, coma, and uremia. The traditional test for life in case of suspended animation is completely outdated now and only for historic importance. Test for circulation. Magnus test. Magnus or ligature test. Hugo Magnus of Italy in 1872. Tie a ligature at the base of the finger, sufficiently cut off venous channels. Redness and swelling would develop at the fingertip if there is intact circulation. That is person is alive. Finger would remain white if there is no circulation. That is, person is just dead. I-card. First is Magnus or ligature test. Next is I-card or a Severin. I-card, France, 1895. Subcutaneous injection of 20% of alkaline fluorescein. The skin would turn yellow in living if there is no discoloration of skin to suggest no circulation. That is, person is dead. Next test is diaphanous test or transillumination test. Hand with a closed but straight fingers held against a strong light, red color in a living person. The color is opaque or yellow. It suggests no circulation. That is, person is dead. Next is fingernail test. Normally, nail bud in a live person is red, and on pressure it turns pale, and release of pressure becomes red again. To suggest a live person. After death, the nail bud remains pale throughout. Cutting off a small artery, jerky flow suggests life. After death, there is low and continuous flow, no flow at all. Next is heat test. Application of heat. If blisters develop, it suggests a live person. If there is no blister forms, it suggests death. Test for respiration. Winslow test. Jacques Ben-Gim Winslow, Danish physician. A glass of water placed on chest. If its surface moves, it suggests chest movement. That is life. Alternatively, place a mirror on the chest. If the reflection of a beam of light moves, it suggests chest movement. That is life. Mirror test. Mirror held in front of a nose or mouth. If it turns hazy, it suggests life. Feather test. Feather held in front of a nose mouth if a mouse suggests life. Test for brain function sensibility. trumpeting or loud noise, inserting a sharp instrument under the nail, pouring a strong stimulant, for example, mustard into the noise, giving incision, pouring hot water or oil, testing for brainstem reflexes. CPR is successful cardiac massage, electric stimulation, artificial respiration. Medical legal aspect. Rule out suspended animation before declaring death and issuing death certificate. It can be confirmed by eliciting brainstem reflexes, getting EEG done. Thank you.